Today I did something that I never thought I would do. I went public with my story. I was selected out of roughly 400 people to sit at a round table with Senator Sherrod Brown, and then to give a speech at a press conference following. I thought long and hard about doing this and going public with everything. Will it hurt my business? Will it affect sales? Will I tarnish my brand? Most importantly, will my friends be ashamed of me? I finally came to the conclusion that anyone who chooses to not associate with me after hearing this, I am glad to say goodbye to. I live my life by the following motto: positive mind, positive vibes, positive life. The key being positive. I accept no negativity in my life anymore. And good things are coming to me that I am excitedly embracing. It's the law of attraction at work here, my friends. Right here in my mind, heart, and soul. This brings me to my announcement. I have been soul searching for a niche for a YouTube channel that I plan to launch very soon. This will be non-related to my JAMBERRY YouTube channel. I wanted to have amazing quality and content that would draw people's attention. After I gave my speech today, my husband looked at me and said, "There's your YouTube show right there." And there I had a light bulb moment. My new program will be about bringing positivity into light and incorporate it into your everyday life, no matter where you've been. Positivity will bring you back. This will be for people of all kinds, ages, races, sex, people who have experienced loss, depression, failure, or have demons to fight. There will be me video blogging or vlogging, as well as interviews with professionals and fun and happy content too. Also success stories of regular people like you and me. I had over 5 people come up to me after my speech and tell me how much I moved them and inspired them. Even brought some to tears. Wow, who knew I could be so inspiring? I will also be doing public speaking, sharing my story and talking about overcoming and, of course, the power of positivity. I don't have a name or launch date chosen yet, but I'll let you know when I do. I can only tell you that it will be soon. This is today's press conference in its entirety. But if you don't want to watch it all, just advance to my speech. I appreciate comments, but as I am living a positive lifestyle, negativity will be deleted. For now, I ask that you watch without judgment, and I hope that you will still be on Team Kimberly when it's finished. Also, as a small favor, will you please support my endeavors on social media? Subscribe to my YouTube channel, not the new one that's coming, but the one I have now, which is www.youtube.com/jamtasticnailart. Like my Facebook business page. That's at www.facebook.com/jamtasticfancynails. Follow Jamtastic Nail Art on Pinterest at www.pinterest.com/jamtasticnailart. And browse the new spring catalog at http://KimberlyMcDaniel.jamberry.com. I thank you, God bless you, and I hope that you will have a positive mind, positive vibes, and live a positive life. Thank you. Hope you enjoy the news conference.
I am proud to be a member of the Outreach Ministries of Friendship Baptist Church. under the direction of Bishop Dwayne Tisdale. Serving in this capacity allows me the opportunity to help others in their pursuit for happiness. I also applaud Bishop Tisdale for having the fortitude to be a pillar in our community, leading the way to ministering to the total man. I am proud to be a provider in the system of care under the direction of the Mental Health and Recovery Services Board. Scott Silek and his team, his staff, spend countless hours on working with prevention and treatment providers and the development of programs and services that will improve the quality of life for anyone seeking recovery. I am so proud to lead a team here at New Concepts, a team of treatment providers and support staff that has the attitude of fortitude. They inspire me every day as they work tirelessly, embracing anyone walking through our doors to begin the process of recovery. And then they equip those individuals with the tools and resources necessary to make positive lifestyle changes, and then they empower the individuals to become productive and accountable citizens of their community. I love my team at New Concepts. I don't think there's anyone better. And standing here today saying thank you really does not express my deepest gratitude to them. Lastly, let me say I applaud any person who has the courage to seek treatment. Recovery, we need to know, is not a destination. It is a journey, and it can be a winding road. However, any person who chooses to manage the disease of addiction, that on any given day is that much closer to becoming a whole person. So I implore anyone who suffers from addiction to seek the services that are readily available to them in our community. Thank you.
Woo! Okay.
Thank you, Janice. Thank you all for being here. And I mean, many of you, I'm at your place, I understand. Thank you for showing up at work today and taking a minute off and eating cookies and listening to all these talks. So thank you, and thank you for the incredible work. I met Chris a minute ago, who is Kimberly's counselor. Kimberly loves her, and Kimberly's namesake, another Kimberly, is your daughter's counselor, right? So,
Lashana.
She was, yeah. But anyway, thank you all for the work you're doing. I'm here because I want to see more up close what New Concepts is doing, but I also am here because what Lucas County is becoming increasingly known nationally for dealing with this terrible opioid epidemic more creatively and more expansively and more effectively than others. And I give Sheriff Tharp a good bit of credit for that, for his view and Judge Manders's view of getting people into treatment rather than jail. There are far too many people in prison. We know that. We look at all the national statistics. We know what that intersection with race and what that has done. And we also know, as Janice said, how important it is that we recognize in this country something we didn't do 20 years ago in certain communities. Regrettably and shamefully, we know that this is an illness. This isn't a character flaw. It's an illness, and we need to treat all of this that way, regardless of race and regardless of age, and regardless if it's a 14-year-old boy who's got a sports injury that started his road to addiction, or a 16-year-old girl going through her grandmother's medicine cabinet who might be in hospice and found some morphine-based drugs, or whether it's a 30-year-old former auto worker that has back injuries and back problems that needs some assistance beyond beyond taking Tylenol. So thank you to all of you. Jay Smith, I will introduce in a moment. My friend John Betts is here. Thank you, John. John works in this field. John also was a hero to me. John's son, David, was on the bus from Bluffton baseball team, who was killed back 9 years ago now, and John has taken on his life's work to make motor coaches safer, and we were able, because of his efforts, to pass a law that buses now, those motor coach buses, whether they're Greyhound or anybody else, have to be safer than they used to be. And one other introduction behind John is a young woman named Tiffany, who I take some pride in helping to launch her national media career. She came and spoke with when the drug czar was in town, right? And that was how long ago? That was a couple weeks ago, about a month ago. Okay. And she is becoming a speaker, and but she told her story, and good to see you again, and thanks for the work you do. Kimberly and Dr. Smith will speak in a moment. Kimberly will tell her story. She worked at Jeep in Toledo for 14 years. She started her own business, and she will tell her story in a moment. She's far from alone. It's too easy today to get a prescription, and in far too many cases people become addicted to these prescription opioids. Deaths due to unintentional drug overdoses are on the rise. As we know, opioid abuse has wreaked havoc across our state. It's a young woman, a middle-aged woman in Warren, Ohio, Northeast Ohio, told me that I hear this all the time, when you have addiction in your family, and her 14-year-old son became addicted and has been in and out of treatment for 12 years. He's doing well now, but she's always worried, of course, as many of you are nodding, that treat people like this or been through it. She says when one person in your house suffers from addiction, the whole family's turned upside down, and it's so obvious, but I don't think people think about it enough and how important that is. More people, as you know these statistics, more people died from drug overdoses last year than any year on record. More people in Ohio, some 2,400 died, 150 in Lucas County. More people die from drug overdoses than in car accidents, as we know. 2,500 Ohio families lose a loved one to this epidemic. We know what that does to those families. It's not an individual problem. It's not a character flaw. It's a chronic disease that, when left untreated, places a massive burden on our healthcare system and especially, more importantly, on our families. The people I've met with, and just had a meeting with a number of you in another room first before this, and I've had dozens of these kinds of discussions around the state. It's clear we need a more comprehensive approach. The days of just looking at law enforcement as dealing with this should be far behind us, and is in most communities. It's obviously the whole spectrum of addiction, crisis, from crisis to recovery, of prevention, of treatment, law enforcement too, but especially just prevention and treatment. Along with my colleague, Senator Baldwin from Wisconsin, I introduced the Heroin and Prescription Drug Abuse and Prevention Act. It boosts prevention efforts. It would improve tools for crisis response. It would expand access to treatment, including medication-assisted treatment, and provide support for lifelong, and I underscore lifelong, recovery. Current law limits the number of patients a healthcare provider can treat with medication-assisted treatment, which helps wean patients off opioid. This means patients simply are on a waiting list. They want treatment. They know they need treatment. They can't get in because the doctor has a cap of 30 the first year, 100 the second year, a permanent cap on what they can do. It's particularly ironic given that doctors have a cap on treatment, the number of patients, but there's no cap on prescribing opioids by those physicians. And I'm not accusing doctors in most cases, of abusing this. I'm not accusing drug companies of abusing this, although drug companies make a lot of money from this, and I'm not sure they've been quite as responsible as they should have. But clearly we need to focus on this in that way in part. Our bill would allow providers to treat larger numbers of patients with Medicaid-assisted treatment. We know from new concepts, we know from the work that ProMedica and Harbor are doing, that we know how to do these treatments. They work, they save lives, they put patients on the path of permanent recovery when done right. The Senate passed yesterday the Comprehensive Addiction Recovery Act. Was an important first step. The medication-assisted treatment provision will be included in a larger legislative package, we hope, on mental health and substance abuse. We have included in this a lock-in for Medicare beneficiaries. Nobody really thinks about people in their 60s or 70s, as Dee was pointing out earlier, who get addicted in part because they go to 3 or 4 different specialists. A 70-year-old and get treatment from 3 or 4 different specialists, and more than one of those doctors might prescribe an opioid, and they end up addicted. And what this does is, if Medicare is going to pay for an opioid prescription, whether it's OxyContin or Oxycodone or Vicodin or many of the others, that only one doctor can prescribe and only one pharmacist can fill, protecting those Medicare beneficiaries from more likely addiction, and helping a doctor manage care across many specialties better. The only way we stop this epidemic is by combating at every level, from prevention to treatment to recovery, and what you are all doing in Northwest Ohio, and I mean all of you in this room in each of your different ways, is so very, very important. I will turn it over to Kimberly McDaniel, who will tell her story when it's ready, and she was really good this morning.
Well, thank you. Hi, I'm Kimberly, and this is my story. I had many successes in my adult life. I worked very hard to achieve what most people would consider a very comfortable existence. I had a high-paying job that I worked at for 14 years. Although it was a very physical job, it allowed me the opportunity to give my family what they needed, and then some. But I was not content. Because I came from a long line of small business owners, I felt that being my own boss was my destiny. So I took a buyout and started a business of my own. I loved every aspect of being a small business owner. I had discovered my true calling. Then the recession hit, and my life went into a downward spiral at warp speed. I lost my home, business, and pride, still suffering the side effects of working a physical job, such as arthritis, pinched nerves, displaced discs, carpal tunnel, plantar fasciitis, and more. I began a pain management program and was prescribed opiates. Thus began my path down a very long and slippery slope. I took painkillers for many years, along with suffering from severe depression, which runs in my family. My father took his life when I was only 13. Well, let me tell you, opiates and severe depression do not mix. The reason for that is because you start to take more and more of your painkillers, because not only do they make you feel better, but calm you down, help you to function, and to create the facade of maintaining a better life. But as far as having a better life, I was fooling myself. My life was far from normal. In fact, I could take my monthly prescription in one day, spending the remainder of the month coming up with ways to get more opiates, so that I would not be sick for that day. That was an everyday occurrence, and it consumed me. After many failed efforts to quit on my own, I tried a few programs with no success, until I came across a local doctor who prescribed me Suboxone. This particular doctor practices medicine right here in our city, and is a malpractice suit waiting to happen. He was very rude and disrespectful to me, and often told me how disgusted and ashamed I should be with myself, as if I needed him to tell me that. So one day, I felt unable to make it through one more day of his foul bedside manner, and I just quit. I just walked out and quit, mysteriously thinking that I would be fine. But I was far from being fine, and spent a month or so searching daily for drugs off the street to stop me from being sick. Then someone told me about new concepts, and I made an appointment right away. There I was met with open arms. I felt loved and wanted. I knew that I was home, so I worked my program very hard, and I did everything that I was told to do. It was very time-consuming, and I would have much rather been doing other things. However, I was where I needed to be, and so I stayed. Taking Suboxone helped me have the ability to focus on what was going on around me and participate without being sick. When I first started here, I had come from a very dark place, and my goals were not much. I only wanted to stay clean and be happy with my family and my precious grandchildren. My journey has taken me far beyond that. I now have a business of my own that I am branding by studying the ins and outs of social media. My business has a Pinterest and Facebook account and a YouTube channel, as well as a website. I run them all. I perform daily proprietary tasks such as, but not limited to, ordering products and marketing materials, warm and cold calling, hostess and recruit training, customer service with a special VIP customer loyalty program, as well as running multiple online and in-home parties each month, all scripted by me. I will begin to write, direct, edit, and produce another YouTube channel this summer that will not be related to direct sales. My 3-year plan includes being financially secure with only the income of my YouTube channel and other social media related activities. Many people show no compassion for drug abusers, never taking into account their history, story, or past. They are hating a word, and that word is addiction. But as the words of the great Dr. Martin Luther King state, if you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving forward. And as members of a civilized and dignified society, that, my fellow brothers and sisters, is what we all must continue to do. I would like to thank you for taking the time to listen to my story and to open your heart and care about the stories of others and to never stop showing human compassion for the better of man and womankind.
I guess I've been asked to say a couple things about what's called medication-assisted treatment, which mainly is Suboxone. Also methadone, but we don't do that. Suboxone is an opiate. It's not quite like heroin. It doesn't produce euphoria, but what it does in someone who's addicted to heroin or OxyContin, it keeps them from getting sick as they're withdrawing. Now that is not a cure-all. Some people go through recovery without Suboxone. Some people fail to go through recovery despite Suboxone. But there is a subset of patients who do very well with it. Addiction is more than simply avoiding being sick. There are other issues have to be dealt with, and that is why the counselors here, they actually do a far more important job than I do. I just write a prescription for Suboxone. It enables them to concentrate on the other issues without just being physically sick. Now, there's withdrawal from Suboxone, just like there is from heroin. But the thing is, they can be withdrawn slowly from Suboxone so as to not go through withdrawal. And that can be done over weeks or even months when they're ready. Suboxone is much safer to take than heroin. I won't say it's impossible to take an overdose of Suboxone, but it's much easier to take an overdose of heroin because you don't even know what you're getting with a bag of heroin. So that's basically the idea of. Did you want me to say something about the 100 patient?
Just like what it
Yeah, there's a limit. We're allowed to have 30 patients on Suboxone in the first year that we have the Suboxone ticket or license, if you will. And then after that, it's 100. First of all, it's virtually impossible for me to know how many patients I even have on Suboxone because people are always leaving and new people are coming in. It's always in a state of flux. So I don't even know how many patients I have. I think the limit is there to prevent someone from opening a Suboxone mill out on the street corner and you come in, plunk down a $100 bill or whatever the going rate is and you get a prescription, which you then turn around and sell. So I can see that they want to prevent that, but in a place like this that is part of a comprehensive treatment program, I don't think there should be a limit. A limit will naturally occur here, for example, simply because there are only so many patients we can physically accommodate. So it will limit itself, but in a place that is clearly not a profiteering Suboxone mill, I don't think there should be a limit. I don't think that's productive. So.
I do want to say, although Dr. Smith may not know the actual count of his patients, we have an excellent support staff that maintains that information. And of course, he is not over the limits.
If 5 people drop out, I may not know that for 3 weeks when someone says, hey, they haven't shown up. So that's 5 people I could have treated that I can't because I don't know that they're no longer on the list. That's it.
Thank you all. I can see why Jan is such a good administrator. Do you want to turn it off? I don't know. If you want to do questions, thank you all the staff that's here.